I'm going to ask all the speakers from this panel to please come up and sit up here so we can have a little bit more discussion. If anybody has any specific questions that they want to start off with, or if we want to continue on with the discussion we started with Michelle's group, either way.
I just had a quick insurance question, I think, for Michelle. I learned something new today. Two of my siblings don't want to get tested, but I appreciated the information that even if they don't want to get tested, they still qualify for increased screenings. Does that apply to their children? Or is that only at this 1 degree level, or?
That is the son. Yeah. That is a good question. Most often when we do that, it's to the individuals that we know are at a 50% chance. Now, certainly in some families, you may have, say, someone who's deceased and we're now at 25% chance. I think it would be worth a conversation. It is truthfully something that a lot of families don't know, that you don't have to do testing to start that screening. We have people who say, I want to get a life insurance policy in place. Maybe they're 21, 22, they're in college. It might not be the right time. People can start screening. I will tell you where it gets a little bit tricky, though, is, say you have a female who is 35 to 40, and now we're talking about like the ovaries and the uterus. If we're getting to the point where like we're actually talking prophylactic preventative surgery, then we really want to have a test result. It is helpful because it's one thing to do screening in someone where, we don't know their genetic status, to do surgery and to have that risk. But certainly we see many families who do it. And it is definitely something that we talk about. We have a lot of families kind of hit the pause button and say, I need some time. I need to get life insurance in place. This may not be the right time. And we say, we can refer you and get screening started regardless. So thank you for sharing that.
I'd add that we see it a lot where the recommendation is screening and that the family's on board and the providers are on board. And when an insurance pays for it, it's a great plan. So what I actually experience more clinically is that our families are having trouble with reverse discrimination, and that it's that you can't get the screening paid for by insurance without doing genetic testing, as opposed to the other way we usually talk about discrimination. But that usually it's the recommendation to do the screening, even at the 25% risk, if you might be at risk. But it's hard. The further away you get, the harder it is to get insurance to pay for it.
Thank you. I think my question might be for Dr. Roeca. It's two-tiered. My first question being, when thinking about IVF for patients of Lynch who have Lynch, has genetic testing of the egg and sperm donors become a standard? Because in the context of this conversation, we're trying to prevent then, having that that genetic mutation in our children. And the second part of my question is, since there is an increased risk for gynecological cancers in Lynch syndrome, are there any studies assessing the risk of increasing Lynch syndrome related cancers as a result of all the hormones and things that go into IVF?
Mm-hmm. Yeah, those are great questions. So when thinking about choosing a donor, typically like sperm banks, egg banks are going to exclude donors who might have a family history that's suggestive of a familial cancer syndrome. And anybody who's using donor gametes, we require to meet with a genetic counselor. So the intended recipients of those gametes also have to review the results of the genetic testing with a genetic counselor, so everyone's fully informed. And they'll suggest, this person seems to have a family history, suggested that they might require further hereditary cancer screening. And in those situations, often it will be up to that person to decide if they would like to have that risk or not. But a lot of the banks up front will say no, and that's an exclusion criteria.
Well, with PMS2, that's sometimes a sporadic mutation, so family history may not be helpful.
And that's something where it's a risk, you know, and no matter what, you know, again, you know, 20,000 gene pairs. So we know about one. That doesn't mean they're not going to be susceptible to something else. Anytime you're having a kid, there's risk, even if you're doing the gene testing or anything. So I think that it's always, but we do the best that we can with the information that we're given to make sure that patients are fully counseled. Like I said, that includes for everybody meeting with a genetic counselor. And then to your next point, so you know, looking at, does IVF and infertility treatment, you know, increase risk for ovarian cancer? Does it increase risk for breast cancer? Generally, things like the pregnancy state are thought to help prevent risks of those cancers. And we know that often data from infertility is tied to increasing age, which people who are older are already at increased risk of these cancers. So infertility treatment itself has not been linked to an increased risk.
This is a question for Michelle. So in the tradition I was raised in, you were encouraged to go to confession, and then you would tell, you know, you would say so many Hail Marys, and then the priest would say, "Go now and sin no more." Well, I think genetic counseling and cascade testing is kind of like that. We find a mutation in a patient variant, and we basically say, "Go tell your family members," and then we just kind of hope they do the right thing. Okay, I think that's a terrible model, personally. You know, so there's so many bases for family dysfunction where we don't communicate for so many reasons. I mean, let's face it, everybody's got that crazy aunt locked in the attic, right? Or some equivalent of that. Somebody in the family that's just kind of cut off, that either we can't talk to, or they won't listen, or whatever. But there are studies, and I think I know where you're going to go with this, but there are good studies, mainly from Europe, that show that families tend to trust information from their providers more, and they would actually welcome the opportunity for the provider to be doing that outreach and communication, because I'm not sure what to tell my relative. I'm not sure they'll hear what I have to say. But if it comes from a reputable provider, nothing will get lost in translation. They're more likely to believe what they hear and so forth. And lastly, as I'm sure you know, in New Zealand and parts of Australia, that model's been adopted, and the providers, the genetic counseling providers themselves, are the ones that provide the outreach to the family members. And they have data showing that the uptake of counseling and of testing are much higher. In one slide, you showed that one of the provider barriers is that there are policies against it. The policies against providers communicating directly to relatives are baloney. I mean, there's no real foundation beyond, we don't want to bother and we don't really have the resources to do it. So I think some of the things like connect the variant may be steps in that direction, but you know, we need to really be, I think, as providers, we need to really be prepared to be much more proactive and participating when the family wants. You know, only with the permission of the index patient, obviously, you know, HIPAA and all that. Only with the explicit permission of the index patient and the family are we allowed or able to communicate with other family members. But that's really all it takes, is consent on the part of the index patient. And notions that there are policies against doing that, we're just making stuff up. And we need to do that. That's kind of my commentary on that. And if Brian wants to comment about how Connect My Variant may be kind of a step in this direction, that would be great, but I think there's a lot more we need to do, and advocates can help. So, thanks.
No, thank you very much for that. You are 100% correct. We need to do better. We need to do better. And you're right. You know, some of the families say, "Hey, can you help me? Can you, you know, we give, you know, certainly written information, summarizing everything, because it's a lot to digest. It's a lot of information. And, you know, I think having that written information that they can share with their family members, but really helping these relatives then find those resources. You know, unfortunately, state licensure laws, they prevent, someone in one state from providing genetic counseling in another state. And that's a whole other topic because licensure is good, but it also creates another barrier. I can't provide genetic counseling to someone who lives in Ohio. But even though those barriers might exist, we know how to overcome them. And we need to do better. Get them connected with people who are there. I totally agree with you. We need to do better. Brian.
Wait, hold on.
Sorry.
Go ahead.
Dr. Lynch kind of stole my thunder. So that was one of the points that I was going to make. Just the, when we found out about Lynch and our family, it was because a lot of my paternal uncles, including my mom, were diagnosed with colon cancer at a very young age. So then that's when I felt like it was my responsibility as I'm one of the oldest of 50 plus first cousins. So I felt like it was my obligation to educate the rest of my family because there was lack of information, lack of resources, and also culturally. We found out it comes from maternal, so grandma. She was very offended that she had passed this on to her children. And so just the lack of information. And so I feel like, yes, more resources, more information, but also culturally sensitive. That's a huge lack or part that we're missing because I still, out of all those 50 plus cousins, only like a handful of us have been tested. And even with our uncles, or like in my case, mom, who had cancer, it's just hard. When they sent me home with that booklet, I called everybody and not everybody followed through.
Thank you for sharing that.
Yeah.
And I can totally appreciate where you're coming from. I will say though, and we talk about this in terms of the uptake of genetic testing being, 30%. I do like to think of it the opposite way though, and that is for those cousins, for those relatives that have taken your information and they have done genetic testing, every person that uses that information to test, you have potentially saved a life. And that is huge. It is, we're never going to get to 100%. It'd be wonderful. But no matter what our numbers are, yes, we need to do better. Yes, we need to provide our families with more resources, but every single relative that you can touch, you can truly save a life. So, Brian.
That's it. Thank you. No, but if there are barriers, like Dr. Lynch, you asked kind of, yes, it's a crime that genetic counselors aren't reimbursed for following up with family members because they're trained to do it, and that's what they do it. And so we started Connected America because we found no resources out there specifically directed at family outreach, and they need to be out there. And like all the other advocacy groups and all the physicians and genetic counselors here do their jobs really, really well. But this was a place we didn't find anything. And so every single barrier on that barrier list, we're trying to, and actually for so many of them, we just very successfully say kind of this barrier, we're just going to eliminate it by providing the right resources for that specific situation. But what we found is that we can't do it on our own. And we could have a family outreach navigator, but really is we really need to partner with everyone in this room. And we need those partners, and with the right resources, you can reach out to your family members. With your right resources, you can get your crazy uncle to get genetic testing. It might take 5 years, but you can. And with the right resources, there's an amazing amount of things that we can do together. And then the other thing about the culturally sensitive communication, I wanted to follow up on that. There is no more culturally sensitive way for your family to receive information than receiving it from you. No genetic counselor is going to understand your family better than you understand your family. And no doctor is going to understand your family better than you understand your family. And so when you think about that, then that, and if the optimal thing is for you to partner with your aunt or your cousin or your brother who also is interested in it. And that's really where we also see that, don't think you're on your own. Find the other people that are in your family that have been tested, whether they've been tested positive or negative, and bring them in. Bring your spouse in. Some of the most powerful advocates we've seen are people who are the spouse and the parent of somebody who has Lynch syndrome. We see somebody say, I'm going through cancer now. I can't talk to my family. We say, well, talk to your brothers and sisters. And the brothers and sisters say, absolutely. I wish I could do something for my sibling who's going through cancer. And you've given me something I can do. Thank you so much for giving me something I can do to help, because I can't go through chemo for you. So it's that type of community building within a family is really, really powerful. And so there really are not barriers that can't be overcome. And most of those barriers don't take a lot of money. They just take a lot of care and time and conversations. Thank you.
I'd like to ask the audience if anybody has anything to share that they've done within their own family that they felt that was worked.
That's a great question, Lisa.
Yeah, this is my first time sharing this story, so it's going to be hard. But
we're with you.
My mom was diagnosed with breast cancer October of 2021, exactly 2 years after my dad was diagnosed with lung cancer. After that, I opted not to do genetic counseling despite the fact that my mom does have a positive BRCA mutation. I said, I'll just do the screening. Yeah, I immediately did a mammogram. 6 months later, I did an MRI, and that MRI saved my life. I was diagnosed with breast cancer May of last year. I did chemo. Please don't share this video. I'm sharing it with this group because I feel really connected with all of you. So after I was diagnosed with breast cancer, I went ahead and did my genetic counseling. They found a BRCA2 and a PMS2 mutation. Sharing the BRCA2 mutation with my family has been challenging. At one point, one of my cousins said to her mom, who also has it, oh, well, that's a great inheritance. It's a very challenging thing to share. And even if we do know our family, to his point, it doesn't make it an easy message to share. So we haven't done genetic testing on my dad yet. I don't know if my PMS2 is spontaneous or not, but I really rejected doing the genetic testing until it was obvious to me that it would be helpful. So if you're questioning it, please do it. It might save your life.
Thank you so much for sharing your story, and we all really appreciate that. Oh, well, we got one more person, and then we'll ask that question. How's that?
You asked if anyone had another story to share as far as what made a difference. It could have made a bigger difference had I seen more response, but I attended a family reunion after I found out about Lynch syndrome and having it. And having the additional information that my sister, who's 9 years older than I am, and who had pancreatic cancer diagnosed before I got my uterine cancer diagnosis, then later found out she was positive for Lynch also. But we attended a family reunion that was my mother's side of the family. And if I had, because of the number of cancer cases in that side of the family, that's where I would think my inheritance has come from. But anyways, my mother's side of the family had 13 children, and on down the line. So there were a lot of people. There weren't that many attending the reunion, but I still thought word of mouth would spread. And if I got through to even half of the 13 as family representatives down the line, out of that presentation that I made and saying, this is what I have learned and what I want to share. And if you have any questions, get in touch with me. I got 2 responses from cousins who were willing to go out and have their own testing. 2 of so many, but neither one came back positive. But still the word was out there. And so I'm just saying that's another avenue for people to get the word out if you go to a reunion to speak up.
So like, I'm taking this letter to the family reunion and we're going to talk about, I know it's not something that, like, talking about a colonoscopy, it's not something we're going to do at the dinner table, but that's the time to do it. You have to do it. And, oh, thank you. And the other thing that I will say, and Brian had alluded to this, you know, I think in many families, it can be a domino effect where, okay, no, maybe you don't have everybody go out and do testing all at once, but you have one person who tests and then they talk to another relative and they're like, yeah, I should probably get tested too. That person gets tested. And maybe that person is, you know, they have a better relationship with Weird and, you know, Linda, and then she gets tested. Every single person that we talk to, it is truly a domino effect in terms of we're increasing that message in the family. And again, every person who does decide to test, that is potentially a life that we have saved. And so I have talked to so many of you today, and everything that you guys are doing, you guys are here for a reason, and you are doing all the right things. You let us know if there are other things that we can do to help your efforts, because it takes a village, and that is why we are here today. So
I just want to add to that, you're all amazing advocates, I'm going to assume, and going through so much on your own that you can lead a horse to water, but you can't make it drink. So you can educate, you can let people know, but if they make their own choice not to listen, you can't hold yourself responsible for that. That's their choice. And I also want to add a resource for people that need access to a genetic counselor. Find a genetic counselor.org is a place people can go if they live out of state or somewhere else and are looking for a genetic counselor.
All right. Thank you, everybody. This was an excellent session, and I really appreciate this panel. So let's thank them again.